Welcome to another video on glaucoma. In this video, we will discuss how aqueous humor is drained and what are the effects that are produced when intraocular pressure is increased. That is, what are the damages that are done to the optic nerve. So, drainage of aqueous humor occurs by flowing of aqueous humor from the posterior chamber into the anterior chamber. How it flows from posterior chamber to anterior chamber? Through the pupil, and here the slight physiologic resistance is encountered. So the from the anterior chamber, the aqueous is drained out by the two routes. First one is trabecular or conventional outflow. Trabecular meshwork is the main outlet from the aqueous from the anterior chamber. So trabecular meshwork is the component of the anterior chamber angle. 90% of the total aqueous is drained out this trabecular meshwork. Free flow of aqueous occurs from trabecular meshwork into the inner wall of Schlemm's canal, which appears to provide some resistance to outflow. So, from trabecular meshwork, Schlemm's canal takes up the aqueous fluid. Mechanism of aqueous transport occurs across inner wall of Schlemm's canal. It is partially understood. Vacuolation theory is the most accepted view. According to it, transcellular spaces exist in the endothelial cells forming inner wall of Schlemm's canal. These open as a system of vacuoles and pores primarily in response to pressure and transport the aqueous from the justa canalicular connective tissue to Schlemm canal. So, in this way, aqueous humor enters from the trabeculi to the Schlemm's canal. Here you can see from the posterior chamber, here these are ciliary processes that produce the aqueous humor, and here from the posterior chamber it enters through the iris through the pupil into the anterior chamber, and then it reaches the anterior chamber angle where it is taken up by the trabecular meshwork and then into the Schlemm's canal. From the Schlemm's canal, the aqueous is transported via 25 to 35 extracellular collector channels into the episcleral veins by direct and indirect systems. A pressure gradient between intraocular pressure and intrascleral venous pressure, about 10 mm of Hg, is responsible for unidirectional flow of aqueous. Second is juveoscleral or unconventional outflow. First one was trabecular outflow and second is juveoscleral or unconventional outflow. It is responsible for about 10% of the total aqueous outflow. Aqueous passes across the ciliary body into the suprachoroidal space. From suprachoroidal space, it is drained by the venous circulation in the ciliary body, choroid and sclera. So what is the pathogenesis of glaucomatous ocular damage? As mentioned in the definition here, all glaucomas classified what we have discussed in the classification are characterized by a progressive optic neuropathy. It has now been recognized that progressive optic neuropathy results from the death of retinal ganglion cells. Retinal ganglion cells are destroyed in a typical pattern which results in characteristic optic disc appearance, that is optic disc cupping and specific visual field defects. Pathogenesis. What is the pathogenesis of glaucomatous damage? Actually, the retinal ganglion cell death occurs, that is initiated when some pathologic event blocks the transport of growth factors, neurotrophins, from the brain to the retinal ganglion cells. Actually, these neurotrophins are required for the maintenance of these retinal ganglion cells. So when these are not reaching from brain to retinal ganglion cells, then it leads to apoptosis of retinal ganglion cells. The blockage of these neurotrophins initiate a damaging cascade and the cell is unable to maintain its normal function, and therefore they undergo apoptosis and trigger apoptosis of adjacent cells. Apoptosis is a genetically controlled cell suicide program whereby irreversibly damaged cells die are subsequently engulfed by the neighboring cells without eliciting any inflammatory response. So, no inflammatory response is produced in case of apoptosis of retinal ganglion cells. Retinal ganglion cell death is of course associated with loss of retinal nerve fibers, as the loss of nerve fibers extends beyond the normal physiological overlap of functional zones. The characteristic optic disc changes and specific visual field defects become apparent over the time. Etiological factors. Factors that are involved in the etiology of retinal ganglion cell death and thus in the etiology of glaucomatous optic neuropathy can be grouped as below. 1. Primary insults. First one is raised intraocular pressure, that is mechanical theory. What it proposes that raised intraocular pressure causes mechanical stretch on the lamina cribrosa and it leads to axonal deformation and ischemia by altering capillary blood flow. So it leads to axonal deformation and ischemia by altering capillary blood flow, and as a result of this, neurotrophins, that is growth factors, are not able to reach the retinal ganglion cell bodies in enough need that is required for their survival. So they compress on the axons and therefore neurotrophins cannot reach the retinal ganglion cell bodies from the brain, and therefore apoptosis of these retinal ganglion cells occurs. Second one is pressure independent factors. Vascular insufficiency theory. It means that there are some factors that affect vascular perfusion of optic nerve head in the absence of raised intraocular pressure, and they can lead to glaucomatous optic neuropathy in patients with normal tension glaucoma (NTG). However, these may be the additional factors in cases of raised intraocular pressure as well. These factors are failure of autoregulatory mechanisms of blood flow. The retina and optic nerve share a peculiar mechanism of autoregulation of blood flow with rest of the central nervous system. Once the autoregulatory mechanisms are compromised, blood flow may not be adequate beyond some critical range of intraocular pressure, which may be raised or in normal range. There are vasospasms, for example, that occur in the case of Raynaud's phenomenon that can lead to vascular perfusion, decreased vascular perfusion of the optic nerve head and retinal ganglion cell damage. Systemic hypotension, particularly nocturnal dips in patients with nighttime administration of antihypertensive drugs, has been implicated in these patients for low vascular perfusion of optic nerve head resulting in NTG. Other factors such as acute blood loss and abnormal coagulability profile have also been associated with NTG. What is NTG? Normal tension glaucoma. Secondary insults, excitotoxicity theory. What it proposes that neural degeneration is believed to be driven by toxic factors such as glutamate, excitatory toxin, oxygen free radicals, or nitric oxide, which are released when retinal ganglion cells undergo death due to primary insults. When retinal ganglion cells undergo death, then glutamate, excitatory toxin, oxygen free radicals, or nitric oxide are released, and these lead to neuronal degeneration. In this way, the secondary insult leads to continued damage mediated apoptosis. Even after the primary insult has been controlled. So in this way, the secondary insult leads to continued damage mediated apoptosis even after the primary insult has been controlled. Thank you for watching.